Hi, this is Dr. Perry Carpenter. I'd like to thank you for taking the time to join me on this week's video. On this week's video, we're continuing with our ongoing series entitled Recurring Themes in the QME Evaluation. And just to reiterate the philosophy of this series, is we're talking about scenarios, situations, and circumstances that you're going to encounter as a QME time and time again. And as I recall back upon my career as a qualified medical evaluator, it seems that in the first 100 or 200 or 300 QME evaluations that I did, it seemed that I was encountering each of these situations, each of these scenarios, and each of these circumstances newly for the first time. But after about 300 or 400 evaluations, I started to notice that while there were an infinite number of examinees, the number of situations, scenarios, and circumstances were quite oppositely finite. And I started to notice that the same themes, the same circumstances, started to recur over and over and over again. And I'm sure if you have a couple of hundred evaluations under your belt, you've started to notice trends and themes in the evaluations that you're called upon to perform. And so in the first session of this series, we talked about job dissatisfaction and how it seems that examinees who score high on job dissatisfaction scales seem to file claims for workers' compensation benefits at twice the rate of employees who score high on job satisfaction scales. And examinees who have job dissatisfaction tend to suffer disability or twice the duration of disability as examinees who are satisfied on their job. So you will encounter examinees who have some sort of a beef, some sort of a disgruntlement with their employer, and it's important that you be able to recognize job dissatisfaction in your examinee because it affects the totality of the examinee's claim. In our second session, we talked about the circumstance that involves an unwitnessed incident of injury and also the tandem circumstance that involves a delay in reporting of an unwitnessed incident of injury. And these are the two major red flags that cause claims administrators to deny claims for industrial injury. Now, you will see these examinees because the law allows the examinee to receive a qualified medical evaluation even when the claims administrator has denied the claim for industrial injury. So you'll see these examinees, and it's important that you be able to determine whether or not the incident of injury was witnessed or was it unwitnessed, and what was the proximity of reporting the industrial injury to the date of the alleged injury. So we also talked in that section or in that session about what your role is in the causation determination in the circumstance when an examinee has an unwitnessed incident and a delay in reporting. And it's very important that you be able to recognize your specific role, your exact role as a qualified medical evaluator when it comes time to opine either for or against industrial causation in those circumstances that involve an unwitnessed incident with a delay in reporting. In our third session, we talked about examinees who fail to cooperate with the treatment program. And again, this is a situation that if you're closely looking for it, you will spot instances and examples wherein the examinee, either on single isolated instances or as a general theme that recurs throughout the treatment duration of the claim, the examinee fails to cooperate with treatment recommendations. And this has many faces, many forms, and many guises, and there's 100 ways that examinees can confound the treatment process by failing to cooperate with the recommendations of sincere doctors who are intent on providing top-rate medical treatment for the express purpose of helping the examinee to get well. Well, when examinees fail to cooperate with the treatment program, it makes it difficult to get the result, which is a positive outcome from the treatment rendered. So these are examinees who will present to the qualified medical evaluation complaining of persisting symptoms and activity limitations largely because they have failed to cooperate with the treatment program. And it's interesting because there's an important distinction between the treatment outcomes of patients in our clinical practice and the treatment outcomes of examinees in the workers' compensation system. It seems that we've become quite comfortable with patients in our clinical practice following the treatment program and going on to experience a positive, beneficial outcome from the treatment rendered. And it seems that, unfortunately or strangely, we've become quite comfortable with examinees in the workers' compensation system who have received excessive and copious quantities and various forms and modalities of treatment, and yet arrive at the permanent and stationary evaluation with you, failing to fully recover from the effects of the industrial injury. They fail to fully recover to pre-injury status. And the question becomes, well, why? Why has the examinee failed to fully recover to a pre-injury status? And in many circumstances, it's because they failed to fully cooperate with the prescribed treatment program. And as I said, failure to cooperate has 100 different faces and 100 different manifestations. And it's important that you be able to recognize failure to cooperate when it's present in your very next case. And that brings us to today's discussion. And I want to talk to you about another of the recurring themes that you're going to see over and over and over again as you continue in your career as a qualified medical evaluator. And that has to do with the examinee who pursues medical treatment outside of the medical provider network. Now, treatment outside the medical provider network represents sort of an anomaly, because when examinees have an accepted claim, their treatment falls within the medical provider network. So how is it that an examinee escapes the tight control, the utilization review process, and the tight control on costs through the official medical fee schedule? How is it that the examinee escapes the tight control of those two factors? Well, they pursue treatment outside of the medical provider network, either through seeking treatment through their primary care physician or in seeking treatment through medical providers that have been referred to them, typically by their attorney. So I want to talk to you today about the scenario that causes examinees to escape the control of the medical provider network, and how to assess these cases in the qualified medical evaluation, and how not to be fooled by these type of examinees when you see them, because you realize that these are examinees who typically have a denied claim. And typically these denied claims are denied because the claims administrator is strongly suspicious for a fraudulent claim. So this is a very important session. I'm sure that you'll find this to be valuable. In your very next 10 cases, you're probably going to have 6 of those 10 cases involving examinees who have escaped the medical provider network and are seeking medical treatment directed by themselves rather than being directed by the employer. So I'm going to assemble a couple of notes, and I have some actual cases that I want to reveal with you today that represent fraudulent cases wherein the examinee has pursued treatment outside the medical provider network, and the claim has been denied by the claims administrator, and then the the examinee is brought to the qualified medical examination for a determination of causation. I have 2 of those cases that represent fraudulent cases. And then I want to share with you a case wherein, again, the examinee presented to the qualified medical evaluation for a denied claim for seeking treatment outside the medical provider network, but in this particular circumstance, the claim for industrial injury turned out to be a bona fide claim, and the claim ultimately became accepted as an industrial injury. So I have some fascinating examples to share from you, some of which you're going to encounter in 6 out of your next 10 examinees. So this is going to be an extremely valuable session for you because you're going to see this theme over and over and over again. So look forward to being back with you here in just a few moments as we continue today's discussion entitled Medical Treatment Outside of the Medical Provider Network. So I'll be back with you here in just a very few moments. Okay, I'm back with you now, and today we're talking about recurring themes in the qualified medical evaluation, and our topic today has to do with examinees who pursue medical treatment for a claimed industrial injury outside of the medical provider network. And what I want to share with you today is based upon a recent report issued by the RAND Corporation, and I have that report for you right here, or at least I have a section of that report for you right here. And I don't know if you've had an opportunity to review the RAND report, but it's included as an attachment to today's video discussion so that you can review it with your own eyes. Now, within this section of this recent RAND report, and this recent RAND report had to do with provider fraud in the workers' compensation system. Provider fraud, that is medical provider fraud in the workers' compensation system. It's an entire report dealing with provider fraud. Well, as qualified medical evaluators, we are not medical providers. However, these cases do end up for a qualified medical evaluation because the law allows for it under Labor Code 4060. Labor Code 4060 governs the so-called compensability exam, which is what brings these examinees to us for an evaluation, generally after the claim has been denied by the claims administrator. So I want to talk to you about these claims because it seems that they're particularly rampant, especially in Southern California. They're particularly rampant to the tune of approximately 30,000 cases per month of this type being filed, with liens being filed at the WCAB on a monthly basis. That's 30,000 cases monthly qualify as this particular type of claim. So you're going to see this claim over and over and over again, and you probably already have seen this claim dozens of times, but you may not have recognized it as such. So I want to talk to you about these types of claims and your particular role in the evaluation of these claims. So this has to do with examinees seeking treatment outside the medical provider network. Now it seems that typically in these types of cases, what happens is we have an examinee who files a claim for a specific injury or a cumulative trauma injury, generally post-employment, after their employment has terminated with their employer. Now, we use the term post-employment to differentiate it from post-termination because post-employment claims are a general term that refers to the termination of employment initiated by either of the employer or the employee. Generally, when we think of post-termination claims, we think of claims where the examinee has been fired or laid off. So we use the term post-employment to differentiate it from those circumstances in those situations wherein the examinee has been fired or laid off, which is referred to more specifically as the post-termination claim. So here we have claims that are filed post-employment. Now, how is it that a claim can be filed post-employment? Well, there's a few labor codes that govern the statute or the time frame wherein claims can be filed post-employment. And I want to share those with you. So to begin, let's talk briefly about some of these labor codes. Now, the first of the labor codes that are involved with these post-employment claims is Labor Code 5402. 5402 is the so-called $10,000 rule. Let me read Section C of Labor Code 5402 to you. It says that within 1 working day after an employee files a claim for industrial injury, the employer shall authorize the provision of all treatment. So within 1 day. Now the examinee can file this claim for industrial injury at almost seemingly any point post-termination. Now with regards to a specific injury, there's a certain time frame that governs the statute of limitations for specific injuries. But with cumulative trauma injuries, it seems that there's almost no statute of limitations that governs when an examinee can file the claim. Examinee can file a claim almost at any point post-termination for a CT claim. But within 1 day of filing the claim, the employer shall authorize the provision of all medical treatment for the alleged injury and shall continue to provide the treatment until the date that liability for the claim is accepted or rejected. Until the claim is accepted or rejected, liability for medical treatment shall be limited to $10,000. So imagine that you're a claims administrator here, okay? And you have an examinee who has not been working for the employer for, let's just say, 6 months. 6 months. And herein comes a claim form indicating injury for the during the period when the examinee was working for the employer. Immediately within 1 working day, the law requires that you as the employer begin to provide medical treatment up to $10,000, and that treatment must continue until the claim is either accepted or denied. Well, if you're the claims administrator getting this type of claim, there's a typical knee-jerk reflexive response. And that knee-jerk reflexive response is basically to deny the claim. The claims examiner denies the claim in order to stop the bleeding from the $10,000. So immediately the claims administrator, as a knee-jerk reflex, denies the claim. Now, this has the beneficial effect on the claims administrator of limiting their liability for what is otherwise a claim that needs to be investigated. But it creates an opportunity for the examinee to escape employer control of the medical treatment and now pursue treatment outside of the medical provider network. Okay? And that's where things get really interesting. Now, under Labor Code 5405, according to Labor Code 5405, 5405 gives us the statute of limitations, or in other words, the time period within which claims for specific injuries can be filed. Labor Code 5405 states, the period within which proceedings may be commenced for the collection of benefits provided by Article 2 or Article 3 or both is 1 year from any of the following, and the following item A is the date of injury. So examinees can have up to 1 calendar year to come back and file a claim against their former employer, up to 1 year following the date of injury. Depending upon the date of separation, this could entitle them to fully 1 year from the date of their last day worked with the former employer. And I have a specific case that portrays this example exactly, and I'll share that with you in just a minute. So that's for specific incidences of injury. Now, what about cumulative trauma injuries? And according to the RAND study and according to my experience, and it's probably your experience as well, the cumulative trauma claims form the bulk of the claims for which examinees are filing claims post-employment. So you're going to see both specific and cumulative trauma claims filed post-employment. These are claims that go on to become denied by the claims administrator, and these are the cases where examinees seek treatment outside of the medical provider network in an attempt and in an effort to get their claim established. Now recall that the definition of a cumulative trauma injury is those types of injuries that occur as repetitive mentally or physically traumatic activities extending over a period of time, the combined effect of which causes any disability or need for medical treatment. Remember, the definition of disability refers to total temporary disability, meaning time completely off work, or even temporary partial disability, which can include any form of work restrictions and or the need for medical treatment. So cumulative trauma injuries cause either disability or the need for medical treatment. Now, the date of cumulative trauma injury is interesting and it's relevant in these cases. And the date of injury, which is described under Labor Code Section 5402, is what creates the loophole for these claims to be filed in the first place, because the date of injury for cumulative trauma injuries can seemingly come at any point after the termination of employment, because of the unique definition of the date of injury for cumulative trauma injuries, which is described under Section 5412, Labor Code 5412. So let's talk about it. Labor Code 5412 tells us that the date of injury in cases of cumulative trauma is that date upon which the employee first suffered disability, so that's need for medical treatment or temporary partial disability in the form of work restrictions, or certainly total temporary disability. And so that's one thing. So the date that the examinee first suffered disability is one component of the date of injury. And here comes the second component. It says, and either knew, comma, or in the exercise of reasonable diligence should have known that such disability was caused by his present or prior employment. So for cumulative trauma injuries, the date of injury for cumulative trauma injuries is the date upon which two things collide. Number one, the examinee first suffered disability, and then number two, the date that the examinee had knowledge that such disability was caused by the present or prior employment. And we're talking about situations that involve prior employment. These are the post-employment claims. So we're talking about examinees who are complaining that they're suffering disability due to their prior employment. So the date of injury has to satisfy two criteria. If the examinee first obtains his knowledge that the disability was caused by the employment after the last date of employment, that becomes a post-employment claim with a date of injury post-employment. And that date of injury can be 6 months post-employment, a year post-employment, 5 years post-employment. There's no statute of limitation upon the date at which the employee can obtain or attain the knowledge that the disability was caused by the employment. And this creates a situation where an examinee can file a claim for a date of injury at any time post-employment. So you're going to see these post-employment claims. Now, let's read from the RAND study and see what the RAND study says about the relative number of cases that we can expect that involve specific injuries up to 1 year following the date of injury, or cumulative trauma claims for cumulative trauma injuries, which can involve a date of injury at any point seemingly post-employment. It says a post-employment claim, and this is from the RAND study now, states that a post-employment claim can be submitted a considerable time after ending the job because under California law, a workers' compensation claim can be filed up to a year from the date of injury, and that's Labor Code 5405. That's in the case of specific injuries. Now, the RAND study says that any sort of allegedly work-related medical condition might be the center of a post-employment claim, but presumably relatively few would involve what might be characterized as an acute or specific injury, the sort of trauma or exposure that arises from an event of sudden and identifiable onset, such as a slip and fall, a motor vehicle collision, or a chemical fire. Now, I do have an example for us today of this exact type of case involving a specific injury, but according to the RAND study, the specific incidences of injury are going to be the exception rather than the rule. According to the RAND study, they say instead, post-employment claims often involve allegations of cumulative injury arising from repetitively mentally or physically traumatic activities extending over a period of time, the combined effect of which causes any disability or need for medical treatment, which can be initially filed up to years after the end of employment. Now, the reason that they can be filed up to years after the last date of employment is because the former employee's realization that he or she has some sort of a medical condition must also be accompanied by knowledge that the condition is industrially caused. Well, how does the examinee obtain the knowledge? According to the RAND study, knowledge can generally only come through the receipt of medical or legal advice that links the condition to the employment. Well, we know that many of these examinees get referred for medical treatment after consulting an attorney. So in those circumstances, it's the attorney that provides the legal advice that perhaps the condition, the medical condition, is related to the employment. We know that. But also, what about medical advice? When an examinee receives medical advice about a condition that they're suffering with, and the advice is that perhaps the medical condition is associated with the former employment, that medical advice is coming from a doctor outside of the medical provider network. In this case, in this scenario, and in this example, the examinee is receiving medical advice generally from their primary care physician. And in discussing their medical condition with the primary care physician, the primary care physician suggests that perhaps the medical condition is due to the employment activities, and the primary care physician encourages the examinee to file a claim for workers' compensation benefits. So this is an example, and this shows how these claims begin in their inception with advices, either medical advice or legal advice, all outside of employer control, outside of the medical provider network. Now, the RAND study describes this exactly. They say that because the relationship between the employer and the former employee has essentially ended, the necessary diagnosis of this medical condition, that is, the necessary diagnosis that links the condition to the prior work activities, would be made by a physician of the former employee's own choosing. And so you need to always be alert of this when you're reviewing the medical records. When you review the medical records, you want to always ask yourself, what is the relationship of the medical provider to the employer's medical provider network? And in these post-employment claims, you're going to see that initial treatment that's initially rendered after the filing of the claim is rendered by either the employee's primary care physician or by a physician that the employee has been referred to, generally through their attorney. Okay? So always check the medical records and try to ascertain the status of the medical provider who's rendering the initial treatment. Many times, and according to the RAND study, this is through the employee's primary care physician. And I have an example to share with you wherein the examinee did exactly that. They sought treatment through their primary care physician, and it was the primary care physician that assisted the examinee in initiating a claim for workers' compensation benefits. Now, in these cases where claims are filed, especially post-employment claims, whether it be a specific incident of injury or cumulative trauma injury, the claims examiners generally have a uniformly consistent response to these types of claims. I mean, what would you do if you saw a claim coming in for an employee who had no longer worked for the employer for a period of 2 years? What would you do with these types of claims? Remember earlier I said that there's as many as 30,000 30,000 of these claims being filed monthly. Each one of these claims is eligible for up to $10,000 of medical treatment under Labor Code 5402. So 30,000 claims, each eligible for $10,000 of medical treatment. What is that? 30,000 times 10,000. What is that? 3 million? $30 million? I'd have to get out my calculator to do the math, but it's a staggering amount of medical treatment that employers could be responsible for and could be paying on a monthly basis on these so-called post-employment claims. Well, in order to stop the bleeding from the $10,000, employers typically will deny these claims and put these claims through a period of investigation. Part of the investigation of the claim involves allowing the examinee to have a qualified medical evaluation with you so that the employee can convince you to opine for AOE, COE, for industrial injury, and thereby help them to authenticate their claim. And remember, there may be as many as 30,000 of these claims being filed on a monthly basis. So, according to the RAND study, as a matter of practice in post-employment settings, the control, the employer control of medical care, which extends during the period of medical treatment under 5402, under the $10,000 of medical treatment, that's a period of time when the employer either retains control of the medical treatment or gains control of the medical treatment, but that control will almost certainly end long before $10,000 in medical services is delivered. An employer's ability to limit an injured worker's choice of treating physician during the $10,000 treatment window is available only as long as the employer does not reject the claim. Does not reject the claim. So either during the time when the employer does not reject the claim or during the period of time that the employer accepts the claim, only during those times do they retain control over the medical treatment of the claim. The minute they reject or deny the claim to stop the bleeding from the 10,000, then they lose control of the medical treatment. It's kind of a catch-22. Either exhaust the $10,000, possibly unnecessarily, or lose control of the medical treatment. The claims administrators are in a bit of a quandary, and right now there's great talk amongst the industry as to what is the best method of handling these types of claims, and the RAND study has put forward some suggestions. But for our purposes, generally, as we speak, the knee-jerk reflexive response of the claims administrator is to deny the claim. Once the claim is denied, that sparks the need for a qualified medical evaluation to resolve the compensability dispute under Labor Code 4060. And that's what brings these examinations to you for your assessment of industrial causation. Are you going to opine in these cases for FOR industrial causation, or are you going to deny in these cases against industrial causation? Well, each case is to be handled individually, of course, and no generalizations can be made. And today I have 3 cases that I want to share with you, 2 of which are cases that the qualified medical evaluator was unable to support industrial causation, and one of which is a case where the examinee truly qualified for workers' compensation benefits for a bona fide claim, even though it was filed post-employment. So cases have to be assessed on an individual basis. But the overriding concern in these post-employment cases, of course, is the prevention of fraudulent cases and the prohibition against authenticating cases that otherwise are not bona fide legitimate cases, but on the contrary represent fraudulent cases. So the RAND report is about provider fraud in workers' compensation. And the philosophy of this study, which I've included as part of today's blog, is that the provider fraud and the rendering of medical treatment outside of the medical provider network creates a great opportunity for providers to render copious quantities of care that may not be necessary and that may not be priced according to the official medical fee schedule. And so this creates an opportunity wherein medical providers can create great dollar volume of services that are rendered on a lien basis. And in Southern California particularly, but also in Northern California, this leads to the filing of great numbers of liens at the WCAB. As many as 30,000 liens per month are filed with the WCAB. Many of these liens, this is according to the RAND study, are for huge sums of money for great quantities of treatment that were never delivered in the first place. That composes the fraud of the scheme. So the scheme seems to involve recruiting ex-employees who become our examinees, recruiting these people to file claims against their employer post-employment. The claims administrator then subsequently, in a knee-jerk reflexive response, denies the claim, and then the employee or examinee pursues medical treatment outside of the medical provider network. And medical providers outside the medical provider network are not subject to any type of oversight through utilization review. They're not subject to any particular fee schedule, such as the official medical fee schedule. And they can quickly run up huge liens for which they later settle for pennies on the dollar. And even though those liens settle for pennies on a dollar, it's still profitable. It's still profitable for the lien holders. Now, the RAND study and the authors of the RAND study question, how could it still be profitable? How could medical providers settle their liens for pennies on a dollar Pennies. In Southern California, it's pennies. In Northern California, it's like 15 to 25 cents on a dollar, but in Southern California, it's even less. How can medical providers settle their liens for pennies on a dollar and still remain profitable? In other words, still continue month after month after year as a business practice, continue to file liens. Well, the authors of the RAND study speculate that the reason that the providers can continue to be profitable is because the services were never rendered in the first place. So this includes diagnostic studies that were billed for and charged for, but never rendered in the first place. I wonder if you've ever suspected that in any of your cases. When you review the medical records and you come across an MRI report, have you ever wondered if there are actual MRI images behind the report? It might be a good idea for you to start requesting those images to determine if indeed the images were ever actually obtained. It goes for diagnostic studies. It goes for medical service procedures. It goes for physical therapy visits that were charged for but never attended. Chiropractic treatment sessions that were never attended but were charged for. Medications that were charged for but never provided or never prescribed. Medical services for which the medical providers can settle their liens for pennies on a dollar and continue to remain profitable. Well, let's read from the RAND study on this. One study suggests that employers deny about 88% of post-employment CT claims. 88%. That's almost 100%. So you can count on seeing these types of cases because the claims administrators just reflexively, automatically deny these cases. They deny it in order to stop the bleeding from the $10,000. The problem is they run into a different problem, a different animal, and that is they end up with an employee who runs up huge liens by obtaining and seeking treatment outside of the medical provider network. About 88% of the claims are denied. Now, these liens ordinarily would only be covered, in other words, the cost for medical treatment would only be covered if there was a favorable result after the WCAB formally adjudicates the underlying composition claim. Or, and this is the great scheme for the profiteers, or if the employer later agrees to pay all or part of such expenses, as the result of a settlement. So did you know that, and can you believe that these claims can settle by way of a settlement in order that the claims administrator can get out from under these liens and get out from under the expensive costs of litigating these liens, because many times just litigating these liens is more expensive than the costs of the liens. And so the claims administrators are often pressured into settling these claims, even for pennies on a dollar, in order to make these claims go away. So who is it that gets the pennies on the dollar? The pennies on the dollar gets distributed to all of the parties involved, including the employee, including the medical providers, including any applicant attorney that may be associated with the employee. And it continues to remain a profitable venture, especially in Southern California. Some healthcare providers will provide workers' compensation related treatment to a patient with no upfront costs and eventually file what is characterized as a green lien to establish the doctor's right to be reimbursed by the employer. And defendants, meaning claims administrators, often feel pressured to settle liens that lack substantive merit, as the costs associated with protracted litigation outweigh the value of the lien. So Each of these cases need to be evaluated individually, but the concern is that a large percentage of these post-employment claims for which examinees seek treatment outside of the medical provider network are fraudulent claims, are involved with the rendering of fraudulent or not even the rendering of medical services, and all of this treatment is being rendered on a lien basis for which medical providers are later settling for simply pennies on a dollar. So none of us wants to be involved in fraudulent cases, and none of us wants to deny an injured worker medical treatment when the injured worker on a bona fide basis deserves medical treatment. When the employee suffers a bona fide industrial injury, none of us want to deny that employee their rights to medical treatment benefits. However, none of us want to be involved in authenticating cases and opining for industrial causation in those cases that are filed fraudulently. So, how can you identify these cases when they come to you in the qualified medical evaluation? And how can you opine correctly, either for or against industrial causation, 99% of the time? Well, that's the whole crux of the matter and the whole purpose of this discussion. So in order to illustrate a couple key principles on how to evaluate these cases, I want to share with you three cases. Two of which were filed post-employment, one of which was filed approximately 1 year from the alleged date of injury for a specific injury, and the other two were filed post-employment. The first one that I want to share with you involves a 45-year-old female vineyard worker. 45-year-old female vineyard worker. Well, on August 24, 2016, this 45-year-old female vineyard worker sought medical treatment from the local emergency room due to symptoms with chest pain, rapid heart rate, meaning palpitations, and rapid breathing rate. And she was suffering from general anxiety and what appeared to be cardiac and respiratory symptoms. So she presented to the local emergency room and received treatment on a non-industrial basis. At the time, the medical treatment and the diagnosis associated with these symptoms came to be discovered to be the result of methamphetamine abuse. Okay? And these are common symptoms from methamphetamine abuse. Cardiac symptoms such as rapid heart rate, chest pain, difficulty breathing, rapid respiratory rate, etc. Well, 1 week later, at the conclusion of her work shift, she again sought treatment, now from a different emergency department, for same symptoms: chest pain, palpitations, bradycardia, rapid respiratory rate, okay? Cardiac and respiratory symptoms. Symptoms of neurotransmitter overload due to methamphetamine use. Well, again, the treating diagnosis became methamphetamine abuse. Well, this caused the examinee to feel so poorly that she never returned to work again for the vineyard. Well, approximately 3 months later, she filed a claim for industrial injury, claiming that those symptoms on those 2 dates of occurrence, those symptoms with chest pain, dyspnea, bradycardia, palpitations, anxiety, were due to the result of an industrial injury, of a specific injury that occurred in the vineyard. Well, she sought treatment 3 months later, after never returning to work, in other words, she took a voluntary layoff, and she filed a claim for industrial injury. And she sought the services of an applicant attorney, and the applicant attorney sent her to a local medical provider who was willing to accept treatment on a lien basis. And the local medical provider who accepted treatment on a lien basis diagnosed lumbar symptoms, trochanteric bursitis symptoms, myofascial pain syndrome, cervical facet arthropathy, lumbar spinal stenosis, sacroiliac joint syndrome, and occipital neuralgia. And the requested treatment was for lumbar medial branch blocks, bilateral L3, L4, and L5. Diagnostic studies ordered included cervical and lumbar spine MRI. Work status was to remain off work, temporarily totally disabled until the next appointment. So when this examinee shows up to the qualified medical evaluation, red flags that the qualified medical evaluator needs to be alert to include the fact that she's suffering, apparently, according to the medical records, suffering from musculoskeletal symptoms more than 3 months after the alleged date of injury, when medical records on the date of injury at the local emergency department suggest symptoms only with the cardiac and respiratory systems, symptoms associated with methamphetamine use, whereas 3 months later the examinee has a multiplicity of musculoskeletal symptoms allegedly related to the industrial injury 3 months earlier. And again, this is a medical provider who plans immediately on jumping right into aggressive procedures, including lumbar medial branch blocks, and also proceeds to order cervical and lumbar spine MRI studies. So this is an example of a post-employment claim that was a denied claim. The examinee sought treatment outside the medical provider network, and in this case, the qualified medical evaluator was unable to opine for industrial causation, and the qualified medical evaluator denied the claim for industrial injury. And this particular claim has many of the components that are described in the RAND report, strongly suggestive of a fraudulent claim. Next one I want to share with you involves a 64-year-old male, and this is not a post-employment claim. This examinee continued to work, although he had an extended period of total temporary disability within the treatment period before the claim was filed for industrial injury. So the industrial injury, the alleged industrial injury occurred on Thanksgiving Day, 2015. Well, the qualified medical evaluation occurred approximately 1 year later on September 2016. So approximately 10 months later, after the alleged industrial injury, was this examinee seen by the qualified medical evaluator. So here's the history of this injury, and tell me which of the components that are described in the RAND report do you identify in this history. The examinee states in his own words, "I worked on Thanksgiving Day 2015 doing my work, and the next morning I woke up and I could not raise my right arm above the level of my stomach. I was trying to work the pain off myself that Friday and Saturday, but the pain did not go away. I was surprised. I was supposed to work on Monday, so I called my supervisor on Sunday and told him about my right shoulder. I told him I was going to the local medical provider because they are part of the union insurance, which I have to make a co-payment to." So he was telling his supervisor that he was going to go to his primary care physician. Primary care physician. He's not filing a claim for industrial injury. He's claiming that he's going to seek treatment from the primary care physician. Primary care physician is medical treatment provider outside of the medical provider network. And this is an example where the employee self-directs their own care. He stated that I can go to any doctor, so I went to the local medical provider, and they x-rayed me and took me off work for approximately 4 days. And I returned to them to get another extension to be off work. And they sent me back to work with no restrictions. So he had a period of time off work. When that time period expired, he went back to get an extension to be off work for more time. But the local medical provider refused and sent him back to work with no restrictions. What does that tell you, or what does that suggest to you about the findings and the conclusions of the local medical provider? They felt that he could return to work without restrictions. Well, based on that, the examinee states, I changed doctors and went to another medical provider locally. There they examined me and took x-rays, and they found significant findings on the x-rays. They wanted to give me injections, but I said no because I didn't want to be stuck with the bills. They took me off work, and I went there 1 to 2 times for checkups. I returned to work on April 15, 2016. So this examinee had a period of time off work from Thanksgiving, the Monday after Thanksgiving, 2015, to April 15th, 2016, a period of time of approximately 4 to 5 months. Total temporary disability with no claim filed for workers' compensation benefits. Well, he later, in July, filed for workers' compensation benefits for a specific injury on Thanksgiving of 2015. This sparked the need for a qualified medical evaluation. The qualified medical evaluation took place again in September 2016, and in this case the qualified medical evaluator was unable to opine for industrial injury because of suspicion for no actual incident of injury taking place on Thanksgiving Day 2015, and no indication that any of the medical treatment that was self-procured and obtained through the primary care physician was in any way related to any industrial injury, actual or imagined. So those are 2 cases that were denied and were strongly suspicious for fraudulent cases, not actual incidences of bona fide industrial injury. But the third case I want to share with you is a different scenario. This one involves a 40-year-old female hairstylist. 40-year-old female hairstylist. The 40-year-old female hairstylist returned to work on 11/1/2013 after 2 weeks of vacation, and she found that when she returned to work, someone had broken her own personal hairdryer. She had her own personal hairdryer. It was an expensive hairdryer. It was a lightweight hairdryer. It was very easy and effortless for her to use. Well, she returned to work and found it broken. So because it was broken, she had to use the standard salon blow dryer that was available. The only remaining blow dryer that was available was an old, clunky, heavy blow dryer, which after a short period of time began to cause her symptoms on a cumulative trauma basis. That was 11/1/2013. By 11/1/2014, she was with a different employer. And actually, she had been working for a new employer by about a month by 11/1/2015. 14. Well, just a couple of days before that, before the 1-year anniversary of the date of injury, she was evaluated for the first time for a workers' compensation injury dating back to 2013 with the blow dryer incident. Okay, so she's now no longer with the employer, she's with a new employer, and she's filing for the first time a claim against the first employer, when all the while her workplace activities with the second employer are the same. She still uses a clunky hair dryer, she's still seeing clients for hairstyling appointments, and her work activities are unchanged. But despite working for the new employer approximately 1 month, she's filing a claim against the first employer, the original employer, on a cumulative trauma basis, even though she's no longer with the first employer. Well, as I said, this case became an accepted case because, unique to this case, which is different from the other two cases, this case had evidence that the condition existed during the period of time while working for the first employer. And the evidence was found in the medical records of her primary care physician. Her primary care physician. In fact, in the 6 months leading to the in the 6 months after the alleged date of injury, she showed no fewer than 3 treatments to her primary care physician reporting symptoms related to the blow dryer and the repetitive activity with the blow dryer. The primary care physician documented in meticulous detail on each office visit industrially caused and industrially related symptoms related to repetitive activities of doing her hairstyling. So this particular claim was able to be authorized, and the qualified medical evaluator opined for FOR, AOE, COE, because the examinee's medical records existing prior to the date of the filing of the claim evidenced that indeed she was suffering from these symptoms, that there was evidence of an industrial injury. So even though this particular case carries with it some of the red flags for fraud that are described in the RAND report, close scrutiny of the medical records showed that indeed this was a bona fide case where the examinee had been to her primary care physician, she was reporting industrially caused symptoms, she was not seeking benefits under workers' compensation, but the medical provider encouraged her to file a claim for workers' compensation, such that even though she completed her employment with the first employer, it was clear that during the period of time that she was with the first employer, the workplace activities caused industrial injury, and contributed to any permanent impairment that she would later find.